Hi, I'm Amy McCarter. Welcome to House Calls, brought to you by KaMMCO, where Kansas healthcare professionals deliver health insight. Today I'm speaking with Sarah Sachs-Jepson, family nurse practitioner, about influenza. Thanks for being here today, Sarah.
Sure, Amy.
I've been hearing a lot about influenza being in our community lately, and can you talk about that a little bit?
Definitely. We've seen a significant increase in influenza cases over the past few weeks, and it's been spreading like crazy. Influenza is a respiratory virus that causes fever, sore throat, cough, runny nose and congestion, headaches, and body aches, lasting anywhere from 4 to 10 days. Some patients may develop vomiting or diarrhea, but this is more common in the pediatric population and is less common in adults. You may hear people refer to nausea and vomiting and diarrhea as stomach flu. These symptoms, in fact, represent gastroenteritis, which, like the flu, is caused by a virus, but is in no way related to true influenza. True influenza symptoms can range from mild to severe and can result in death, particularly in high-risk populations. These high-risk populations include children under 2 years old, adults over 65, pregnant women, and individuals with other underlying medical conditions such as asthma, diabetes, immunosuppression, or other disorders that could impede their ability to fight infections. Individuals considered to be high risk should be in close contact with their provider throughout the course of their illness.
And so what should I do if I get influenza?
There really isn't a whole lot you can do other than treat your symptoms. You can take Tylenol or Motrin for the fevers and body aches, and over-the-counter cough and cold medications may help with the congestion, but most importantly, you need to stay well hydrated. Now, if you're in one of the high-risk populations or at the discretion of your provider, you may be prescribed an antiviral medication such as Tamiflu or Relenza. These medications must be started within 48 hours of the onset of your symptoms, and you should know that these medications are not a curative treatment, but rather they shorten the duration of the symptoms and reduce the risk of developing complications from the illness. Now, I will warn you, these antiviral medications are very expensive despite insurance coverage, and during a flu outbreak, pharmacies frequently run out. So this reason, antiviral treatment is only recommended and should be reserved for those patients considered to be at high risk. Most people with influenza recover from the illness at home without needing any medical or emergency care. If you do develop any concerning symptoms, such as difficulty breathing or signs of dehydration, you should seek medical help immediately.
So how can I avoid getting the flu?
The best way to prevent yourself from getting the flu is to get your seasonal influenza vaccine. Influenza is spread by droplet particles that disperse through the air when an infected person coughs or sneezes or touches their nose and then another surface. During influenza season, and really any time of the year, it's good practice to cover your cough and sneeze, wash your hands frequently, and if you are ill, stay home. The general rule of thumb is to stay out of work or school until you have been fever-free for at least 24 hours.
Great. Sarah, thanks for being our guest today.
Thank you, Amy.
Please join us next Saturday morning for a new health topic discussion on House Calls.